Good morning, good afternoon, or good evening, and welcome to 2012 An Outlook for Pharmaceutical Industry, as presented by the Blue Team for the University of the Sciences in Philadelphia final presentation for the Introduction to Health Policy class. My name is Christine Wysocki, and I'm happy to be bringing this presentation to you today. Our agenda for our discussion will include an introduction to give us all some background and current status level setting, our assumptions to show us what we're assuming might happen in the next few years, a discussion of global markets and the impact on the pharmaceutical industry, systemic healthcare operations and policies in the United States, and executive and legislative political actions in the coming election year. As an introduction, the current status of the world is getting smaller. The E7 nations will overtake the G7 by 2050. Our supply and distribution channels are crisscrossing the globe, and the impact of emerging markets is both a challenge and a remarkable opportunity for pharmaceutical industries. As seen in the next chart, when you compare the United States to other industrialized countries, although our per capita spending is the highest among all these countries, our overall ranking of healthcare quality is last or near last. Included in that ranking is infant mortality and avoidable death rates, which rank last against all other countries. For success in 2012, the traditional way of doing business in the pharmaceutical industry will have to change. We will not be economically or operationally viable if we do not change. While these are compelling and sobering statistics, there are reasonable and fundamental changes the pharmaceutical business can focus on to be in a better position in the coming years. Options worth consideration are aligning with the UN Millennium Goals, which Jess will discuss with you in the next set of slides. The UN Millennium Goals talk about closing the poverty gap. The pharmaceutical industry could capitalize on this goal. We also need to understand the differential healthcare needs and cultural requirements of those we are serving and establish global operational structures in the face of political instability. This will be critical for us as we move out globally. Domestically, our healthcare policies and incentives to bring health to more people is required. Incentives for pay for performance and healthy outcomes will be critical. Structural barriers to healthy living must be removed. We can't expect people to be living healthy if they don't have the access to the healthy foods and exercise that they need to get. The political focus over the next 5 years likely will be on technology, including electronic medical records, transparency of both cost and pricing, and the continuum of care. The assumptions that we are operating under in this presentation include political, social, and economic future, one that's unclear. We know that the current trends indicate that things are changing. The political environment is changing, the economic environment is changing, as well as the social environment that we're operating in. The global market obviously continues to rapidly change politically, socially, and economically. And in 2008, the United States will elect a new president whose goals will likely include, regardless of the party that's elected, providing accessible and high-quality health care insurance, holding pharmaceutical companies accountable to outcomes. Drug development will be focusing more on prevention and outcomes rather than just pricing, and transparent transactions, including cost of business and the price of our drugs, and affordable prescription medications under public and private plans. The world's population is continuing to age and will require more medications for chronic disease. Emerging markets with younger populations will require vaccines. This will be also true for some of the global warming epidemics that we're seeing globally. We're also operating under the assumption that no catastrophic events will derail the globalization process. This would include something like a terrorist attack or some other catastrophic event that would slow down the progress that we're seeing today. I'll turn the presentation over now to Jess, who's going to speak to you a little bit more about the overall status and situation of the global market.
The first part of our final assignment discusses the overall status and situation of the global market. As Kofi Annan once said, "It has been said that arguing against globalization is like arguing against the law of gravity." So what is the globe going to look like in 2012? Well, our team predicts that the global market will continue to be constantly and rapidly changing, shifting toward the E7 countries, which are Brazil, China, India, Indonesia, Mexico, Russia, and Turkey. And the success of that shift depends upon our understanding of cultural, social, and differential healthcare needs of these markets. Another big issue in 2012 will certainly be the laws regarding the reimportation of drugs, especially from Canada and third world countries. Those laws will most likely have loosened. No matter what president is elected in 2008, they all are in support of reimportation of drugs. The third bullet point is that we'll be 3 years away from accomplishing the UN's Millennium Development Goals. And with that being said, the global market will continue to strengthen if those goals are accomplished. The gray factor will increase the need for medicines. That is, that the world's population is growing older and therefore will require more medicine, and the younger populations in some emerging markets will increase the need for vaccines. In addition, chronic conditions in the developing world will certainly resemble those of the developed world, with a significant rise in hypertension and diabetes as these countries become more prosperous. And the underlying reason for that, as it is in the United States, is that people's activity and poor diet the activity will decrease and the poor diet will increase, and people will become obese, and then we will have a rise in hypertension and diabetes worldwide. Urbanization and greater mobility have contributed to the introduction of new pathogens, some of which spread very fast and are very difficult to treat. That greater mobility is driven partly by political and economic instability in certain countries. And finally, when discussing what the globe is going to look like in 2012, I think it's fair to say that global warming certainly will still be an issue, but hopefully there will have been a president who was elected in 2008 who will make global warming a very big issue, and we will be making steps towards improving it. Diseases such as malaria will be of higher prevalence, and in addition, respiratory illnesses such as asthma will be included in the more developed regions as they are in the underdeveloped regions. So by 2012, firms will need to shift their therapeutic areas to include these types of infectious diseases and respiratory illnesses.